We'll give everyone just a few more minutes as they're hopping on. Good morning, everyone. Happy Monday. We're so glad to have you with us this morning for Crucial Conversations. All right, I think we should get started with the event. Thank you everyone for joining us on this, is it still rainy Monday morning? My name is Jean Workman. I am the program manager of Every Baby Guilford. We are thrilled to have you here today for our crucial conversations, the state of maternal and infant health in Guilford County. Every Baby Guilford's mission is to ignite and mobilize Guilford County through partnerships and unified strategies to eliminate racial disparities and prevent infant death. Our vision at Every Baby Guilford is that every baby and family will have equitable opportunities and access to achieve the healthiest start in life. Today, we are going to continue to inspire our community's bold goal to reduce infant mortality disparities by 2026, reducing them by 50%. This is our annual event designed to keep the community informed of our collective action movement to build collaborative solutions that focus on health disparities. During our time together this morning, we are unveiling the most updated data from 2021, grounding the community in the Every Baby Guilford movement, including our why, sharing some accomplishments over the past 22 months since our launch in June 2021, and finally, we will end with our community call to action and reminder for the ways that everyone can become a part of this movement and get involved. Today, we are excited to have the speakers with us that will be assisting us with sharing this information. Before we dive in, Chairman of the Guilford County Board of Commissioners, Skip Austin, thank you so much for joining us and sharing a message from the board. We have Consuela Green, who is the Managing Director of Root Cause Institute, Monet Keys, our Health Equity Manager with Every Baby Guilford, and later Jamela Walker, who is a certified nurse midwife Cone Health from the Cone Health Medical Group, will be joining us to give a partner spotlight for what's happening. At this time, I'd like to turn it over to Chairman Austin to provide a welcome from our commissioners.
Thank you, Jane. I don't know if I can, I guess I can. My video was on at first, so now I see that it's turned on. Let me first of all, thank everyone on behalf of the Board of Commissioners for attending this meeting today. I understand that there are some other elected officials that might be joining us that signed up. I'd like to recognize them. Commissioner Carly Cook, Senator Gladys Robertson has signed up, and Representatives Prices Harrison and Representative Ashton Clemens. Are there any other elected officials that might be joining us this morning?
As of this morning, Chairman Austin, that was all that was on the list.
All righty. Well, thank them for attending. The Guilford County, for a historical standpoint, the Guilford County Board of Commissioners named infant mortality reduction as a priority for our community in 2020. Maternal and infant health outcomes are key indicators for gauging the overall health and well-being of our community. For more than 30 years, Guilford County has remained one of the top 5 counties in the state for high overall infant mortality rates, as it consistently had that higher rate in both the state and the nation. During that same time frame, disparities have remained constantly high. Our early data shows that 60% of infants who don't make it to their first birthday were African Americans from all socioeconomic levels. This is why focusing on infant mortality disparity rates in our community is very, very crucial. Every Baby Guilford has launched a collective action movement, building collaborative solutions that center and works together with the community to disrupt these long-standing health outcomes and racial disparities. We are all a part of this collective elected solution to these problems facing our community. By collectively working together as a community, we can be successful in eliminating the immense disparities that have existed for so long in this community. And the county commissioners, we are putting our money where our mouth is. We want this problem to be solved. And we've indicated that time and time again throughout our retreats, in our meetings. Every time this subject comes up, We put our money where our mouth is. Now we're putting our efforts and our time where our mouth is. So thank you to Every Baby Gifford, Gene Workman, for your work on this issue, and everybody that's taken up their time today to address this issue. And I want to really challenge this group to not, we have a 5-year plan, we have a 10-year plan, but tomorrow is too soon. It's soon, and we need to make sure that we try to work on this every day in order to make sure we erase these disparities with our community, because every life is valuable. And especially in the African-American community, to have that high rate, we need to take some serious concerns, hold the county commissioners accountable, hold this group accountable, and let's us try to solve this problem together. Again, thank you for your efforts, and you will be blessed for doing this for our community. Thank you again, Jen.
Thank you, Chairman Austin, for your message and your longstanding commitment to addressing inequities like infant mortality in our community. I am learning through the book Dare to Lead by Brene Brown to be more vulnerable, and that vulnerability is showing up to do the work even when we don't know the outcome. We are so grateful to so many individuals and groups who have done just that over the past 22 months since launching the strategic direction of Every Baby Guilford. We have collectively shown up to create system-level change. If we can move the slide for our acknowledgements, we could not do this work alone, and we certainly could not do it without financial support from the Guilford County Commissioners. They had prioritized infant mortality reduction in their strategic plan and invested largely into this work. We've also obtained funding from the North Carolina Department of Health and Human Services, the Duke Endowment through Ready for School, Ready for Life, and the Guilford County Partnership for Children. We are incredibly grateful for the investments into this work. We are grateful to the Every Baby Guilford's Board of Directors and the Guilford County Department of Health and Human Services Division of Public Health for their leadership, guidance, and support for this movement. I am grateful for the amazing team that makes up Every Baby Guilford. Elvia Altamirez, Jada Rogers, Leandra Vernon, Tierra Booth, Monet Keys, Noelia Turner, and Rebecca Eliasant. You are all rock stars to this work. And we're also grateful for our partners who helped to create important events like Crucial Conversations to inform and take action with the Guilford County communities. Hey Awesome Girls serves as our communications implementation partner. Root Cause Institute is our collective action backbone and supports our partners in this work. Six Dimensions is our evaluation partner, and Riot for Change is our race equity partner with our phase 2 of that work. Dr. Mark Smith, who is a retired epidemiologist, I could not have done this event today without him helping us to dig through and get the data from the state. Jamela Walker will be with us later from Cone Health to share a partner spotlight to the importance of this work. We're grateful for everyone who has been involved with the work for the past 22 months. We'd love to know who's in our virtual room today. Next slide. So we're going to launch a poll. In addition to those who have helped make today's crucial conversation possible, we could not do this without many of you joining today. We have funders on the call. We have community partners. We'd love to learn more about those of you who have joined us, who's in our virtual room. If you will, please complete this survey so that we can see the diversity of individuals who are with us today. Please check all the roles that apply to you today, because many of us wear multiple hats. All right, we've got about 77% who have participated. I will close the poll in 5, 4, 3, 2, 1, and let's share those results. It looks like 58% are Guilford County residents. We've got 48% who represent parents, 19% of folks who work in education, 2% who are elected officials. We've got 14% who represent a faith-based organization and about 11% who are funders. This is excellent that we've got representation from a multitude of community groups that help build this collective action movement. All right, the state of infant mortality in Guilford County for our 2021. What I want to remind everyone is our data comes to us 2 years behind. So we launched Every Baby Guilford's collective action movement in June of 2021. So this data that we're presenting today represents the data from that year of our launch. And we get the data from the state, and we've been waiting anxiously for it to be released. I'm so grateful for Dr. Mark Smith, who helped us with this. Since launching the Collective Action Strategic Plan in 2021, Every Baby Guilford has continuously stated that maternal and infant health outcomes are key indicators for gauging the overall health and well-being of a community. If a community has poor outcomes that leads to higher infant mortality rates, one should ask what is wrong with that community, not what is wrong with the infant or the mother. As Alexander Den Heifer stated, when the flower does not bloom, you fix the environment in which it grows, not the flower. You can see here that infant mortality rates in Guilford County are still higher than the state and the nation. Our overall infant mortality rate of 7.6 per 1,000 births did not change between 2020 and 2021. Next slide. For many years, Guilford County's rate of infant deaths has been consistently higher than both the state of North Carolina and the county as a whole. And between 2020 and 2021, that did not change. We still remain higher than both the state and the nation. It's important to focus on several years of declining rates before we can celebrate durable improvement in the prospects of Guilford County babies to survive and thrive. You can see here that Guilford County continues to rank as one of the 5 top counties in the state with the highest infant mortality rates. Next slide. The first chart here shows rolling 5-year rates comparing white and Black infants. As you can see, while the disparity gap is still not closing, the Black 5-year rate experienced a small decline of 1.5% between the time frame of 2016 to 2020 and 2017 to 2021. The second chart are 5 years of one-year rates by race, which shows a lot of fluctuation from year to year. Guilford County did celebrate a decline last year from 2019 to 2020 of 25%, but unfortunately experienced a 15% increase in 2021. White infants also had a 15% increase in infant deaths between 2020 and 2021. It is more reliable to focus on 5-year trends than the year-to-year fluctuations. We're wondering how might COVID-19 have impacted these rates in 2021. Next slide. Every Baby Guilford is using 3 measurements for defining our success towards reaching our bold goal, including late or no prenatal care, preterm birth, and low and very low birth weight rates. When looking at health outcomes across all race and ethnicities, it becomes clear that Black women and their babies are doing disproportionately worse than white women and their babies in all 4 health indicators. And in addition, Hispanic women continue to have the highest amount of late or no prenatal care. Next slide. I took a look at the difference between these health outcomes from 2019 to 2021. When we launched in June 2021, we were using data from 2019. So when we started measuring this data in this collective action strategic plan, You can see here that preterm births and low birth weight rates have not had improvements in those 3 years, but Black women have had much improvement for entering early prenatal care, with a 24% decrease in reported late or no prenatal care. And prenatal care is a key indicator for promoting healthy birth outcomes. Next slide. In 2021, Black babies made up 38% of overall births in Guilford County, but 64% of infant deaths. So out of the 44 infant deaths that occurred in 2021, 28 were to those of Black families. It still remains true in Guilford County that for every one white infant that dies, there are 3 Black infant deaths. I would now like to turn it over to Consuela Green, the Managing Director from Root Cause Institute, who has served as our capacity building partner since the planning phase, to talk with us about collective action movement. Thank you, Consuela.
Thanks, Jean. Next slide. So good morning to each of you. And first of all, I figured I'd start off my portion of today's conversation with just a little bit of cuteness. So Zephyr is my grandson, and he is at the center of my why to be a good ancestor to my Z baby, my why for my work with Root Cause and our partnership with Jean, her team, and the Guilford County community. And at Root Cause, it's our mission to be a transformative partner in building, improving, and sustaining social change and initiatives that enable all people to thrive. We are honored to be here with you today and serve as thought partners and capacity builders in this work. So let's get into it. Next slide. So the 2021 data and the persistent and pervasive historical racial disparities shown in the data over the last number of decades, this quantitative data is a part of the story, but it's not sufficient to answer the question, why do these racial disparities persist? It's important that we anchor the realities of these persistent and pervasive racial disparities in a historical and social context. There's a wealth of research that answers this question. And when we embarked on the strategic planning process back in 2020, that also shaped the work. That planning and the historical and social context shapes the work of Every Baby Guilford today. Why do these racial disparities persist? This was one of the guiding questions that framed community dialogues. Through research in those community conversations, it is clear that local initiatives to address these high infant mortality rates tend to include individual level interventions that didn't explicitly address racial inequities. There are a variety of factors that create these inequities, including systemic racism and implicit bias that impact equitable access to quality care and improved health outcomes. Back in 2021, with over 100 people in Guilford County, we looked at this local data, we looked at the impacts of history and the contemporary drivers of maternal and infant health inequities. Community members were very clear in that process. We can't keep blaming individuals, especially Black parents, for the long-standing maternal and infant health outcomes that has kept Guilford County's infant mortality rates high. The community and research supported these key drivers. Research has documented that social and economic factors, racism and chronic stress, contribute to poor maternal and infant health outcomes, including higher rates of perinatal depression and preterm birth among African-American women and high rates of mortality among African-American infants. Community members expressed concern that healthcare is seen too narrowly. It needs to expand to not only include interactions with medical providers and other social and community supports that influence health, but also needs to anchor in listening to community, shaping new innovations, expanding access to culturally appropriate supports. And the community also acknowledged that there's a lack of awareness and knowledge about resources and services and also barriers to accessing these. And together, these are some of the key drivers of the maternal and infant health outcomes that lead to infant mortality that Jean just shared with us. Next slide. This slide has a lot on it. I'm not going to read it to you, but history influences the persistent, pervasive racial disparities we see. One of the core principles of collective action is to ground the work in the history, vision, and other data local to the community to understand the challenge and find emergent solutions to resolve it. The details of this slide is for your reference, so I hope you come back to it when we share the slides and other resources after today's conversation. But Dr. Cooper Owens and Dr. Fett says, the legacy of chattel slavery today are seen in structural racism that has resulted in the disproportionate maternal and infant health deaths among African Americans. We see the reinforcement of the trauma of slavery and ideologies that shaped and continue to shape legal and healthcare institutions and create intentional and unintentional barriers to care. These ideologies then and now strip Black women of autonomy and care and shape the quality of care and support available to them. Past and present healthcare standards and practices make it seem as if Black women's health pathology is the cause of their children's disadvantaged status. And when something goes wrong in pregnancy, birth, or when the worst happens and a Black baby dies, then the mother must not have done enough or done something wrong. Next slide. So it's important that as we talk about not only looking at the data, but also what Every Baby Guilford is aiming to do with you, it's important that you understand how we anchored what has now become Every Baby Guilford. So we anchored our understanding of racial equity and cross-systems change work using the groundwater approach. Some of you may be familiar with the Race Equity Institute. Its home is in Guilford County. And many of you have gone through trainings or are partners with many folks that are practitioners of the groundwater approach. We too are learners of the groundwater approach, and along with so many others. And what we really value is that the Race Equity Institute offers this approach to really help practitioners at all levels internalize the reality that we live in a racially structured society, and that is what causes racial inequities. The groundwater approach uses a fish lake groundwater metaphor story to illustrate this approach. And again, it'll be familiar to some and new to others. But today I'm going to offer you my rendition of the metaphor story. So, a person that loves to fish goes to their favorite fishing lake. They see a fish floating belly up. They want to know, what's wrong with the fish? They come back another time to the same lake and see half the fish floating belly up. Now they want to know, what's wrong with the lake? Later, they connect with some other people that fish at 5 other nearby lakes. Those people share that their favorite lakes also have half the fish floating belly up. So they collectively decide it's time to go deeper to see what is contaminating the lakes and harming so many fish. On the surface, they don't appear to be connected, but they are connected below the surface by the groundwater. Groundwater is water held underneath, and in nearly all surface water features like streams and lakes interact with groundwater. The Race Equity Institute says the groundwater metaphor is really based on 3 observations. Racial inequities look the same across systems. Socioeconomic difference does not explain the racial inequities. And inequities are caused by systems regardless of people's culture or behavior. Think about that. Many efforts are working on the symptoms, trying to fix fish or fix the lakes. Many people and organizations in this community are working on the fish or sort of individual level approaches, and some are working on the lake or single system level symptoms. And when we go deeper to the connecting groundwater, we see that there's a contaminant that is affecting all of the lakes and the fish, systemic racism. The Every Baby Guilford community movement, collective movement, is looking at the long-standing racial disparities in infant mortality as a groundwater or cross-systems challenge. We know that outcomes are worse for Black people across different systems, healthcare, justice, education, and beyond. We believe the work at each level, fish, lake, and groundwater, is important. We also believe if we don't address the contaminant in the groundwater, systemic racism, then we are only addressing symptoms, and the root causes will continue to persist, and those symptoms will reappear. During the design and planning phase in 2020, 2021, the community was clear. They believe systemic racism is the primary root cause of the racial disparities in maternal and infant health that leads to the infant mortality rates that we just talked about. Next slide. So Every Baby Guilford, it's a radically inclusive collective action movement. The Every Baby Guilford team is the backbone support entity working with the community. And it is including people impacted by and impacting the groundwater challenge. We are building a collective with you, not for you. Every Baby Guilford is a movement of people, and you all are a part of this. We are co-designing and partnering to implement collaborative groundwater solutions. Together, we will disrupt long-standing racial disparities and achieve our common purpose. By 2026, we will work collectively to ensure more Black babies are born healthy and live to celebrate their first birthday. Because when we create a healthy Guilford County for Black babies, then we create a healthy Guilford County for all of us. Our collective action is a process of continuous learning, doing, and improving that is necessary to create collective impact together. You'll keep hearing me say together. It's not what is Jean doing, what is Jean's team doing, what's one organization or one other organization or one funder or one other funder is doing. It's what are we all collectively doing. This work is rooted in relationships, and it's about shifting how and with whom we work to ensure common purpose, power, trust, and resources are shared among those most directly impacted by and impacting our groundwater challenge and the maternal and infant health inequities that we see. Next slide. So our hope, our goal, Commissioner Alston said it, Jean has said it. By 2026, we intend to improve health outcomes and decrease racial disparities in the following health areas by 50%. We want to increase the number of pregnant persons that receive prenatal care before the second trimester. We want to together reduce the number of Black preterm and low birth weight births. And in doing both, we will increase the number of Guilford County babies who make it to see their first birthday by reducing infant mortality. And the big hope, and the hope that if we don't name this one, it gets harder and we can keep making excuses for why we don't shift what we do. But we hope in 10 years or even less, we intend to collectively eliminate these racial disparities. Next slide. If you want to learn more about sort of root causes collective action framework, there's tons of resources and materials, but I only put this in front of you all today because I really want you to understand what's the central organizing piece of Every Baby Guilford's work. And what you'll see is in collective action, common purpose to achieve population and systems level change is at the center of this work. So the common purpose to reduce and eliminate racial disparities and reduce infant mortality is at the center of this work. And all of the elements you see around that center, those yellow circles, these are the pieces that are getting built. They're being built, they have been built in many ways. And what you also see outside of this central image are the principles of collective action. And I think it's really important that we understand that this work, collective action, is equity work. It is really about keeping relationships and community both first and at the center of moving towards that common purpose. It's about really understanding the context, because context matters. That's why I spent the time I spent in the time allocated to me, reminding us and grounding us that the larger ecosystem, the social and historical context really are the underpinnings of the cross systems that impact the challenge that we're all working on. And it becomes essential that we understand that that becomes necessary to shift and share power. That this work is about seeking to learn, do, and improve together. If any of us had all of the answers, we wouldn't see what we see already. So this work is emergent work. So we have to balance flexibility and focus. So often we can sometimes look at one thing and say, well, that didn't change. But has the way we work together changed? Have we started really thinking about the mutually reinforcing activities that can really drive towards that common purpose? Are we staying in continuous communication with each other? And do we really value some shared accountability to see the difference and make the change happen? Next slide. This is my last slide. I just want to remind y'all that this is a pathway and it's a journey. We didn't get here in 1 year. We didn't get here in 5 years. We got here in decades and centuries within this racialized structure of the United States. So where's Every Baby Guilford today? We are in the year 2 of a 4-phased 5-year plan. So the plan was made for 5 years. This is where we are in that plan. But we believe that it's about centering and beginning with partnership building, designing and piloting programming, and then learning and adapting along the way. And then as we continue to grow, scaling and continuing that learning and thinking about how this work is sustained and can evolve, because it will have to evolve. This is crucial emergent work. So with that, I'm going to stop talking at you because I would love to turn it back to Jean for you all to see what has been accomplished in the last 22 months. Jean, I'll turn it back to you.
Thank you, Consuela. We are excited to share the highlights of Every Baby Guilford's accomplishments over the past 18 months. And again, as Consuela stated, this is not just Every Baby Guilford. This is us collectively as a community coming together with many programs and services. We have done a lot in partnership with so many in the community. Our efforts include individual, system, and cross-system approaches across our strategic plan. I joke, in the time it takes 2 infants to be born, Every Baby Guilford has collectively created a lot. If you will, show the video. done a lot. I'm pretty proud of our team and the collective work in this community. We've partnered with Racial Equity Institute and kicked off our launch in 2021 with racial equity trainings. We began implementation with community health ambassadors who serve as social influencers in our community. We've recently hired 2 community health workers who are on the ground in our high impact areas to make impact of perinatal health messaging and education in our communities. In June of this year, we will begin a countywide community-based doula program where we will hire a doula coordinator and contract with 5 community-based doulas to provide care to individuals birthing people in our community. We'll be partnering with our home visiting programs for the referrals for that doula program. And in Guilford County Public Health's primary care clinic, we will begin implementing a diabetes management program. Lots are happening in the community, not just with what we are doing, but within our community partners as well. Now, I'd like to turn it over for a spotlight on a research project that we implemented. I'm pleased to introduce Monet Keys, our Health Equity Manager, who led this process with Amplifying Every Voice, and she is going to share the results of that project. Thanks, Monet.
Thanks, Jean. Good morning, everyone. So as Jean mentioned, I'm here today to talk about the Amplifying Every Voice project. I'm so excited to be able to give you an update on what's going on, what we've been doing. Today's presentation will be just a very high level overview about the project. It'll talk about some of the themes that emerge from this phase of the project and how we are working with and talking with Guilford County birthing people. In partnership with Root Cause, with Dr. Stephanie Baker, the Department Chair of Public Health Studies at Elon, and Dr. Kimberly Harper, an Associate Professor in the Department of English at North Carolina A&T State University, and most importantly, in partnership with community members. Amplifying Every Voice is a multi-phase community project to engage parents, families, and the community to amplify their experiences, to create collaborative solutions, and to drive health improvements. With this project, we strive to have intentional engagement with those that are most impacted by the maternal and infant health, racial disparities, Black parents, children, and communities. And collectively, we will lift up the learnings to understand people's lived experiences and the challenges to advance health equity. So through this project, Every Baby Guilford intends to use the best practices for transformative storytelling and community-based participatory research, because we want to gather those experiences of Black birthing people, their partners, their families, healthcare providers, doulas, and other community supports. We also want to share the learnings to co-create collaborative solutions that inform the continuum of care practices and improvement. Next slide. So a little bit about our project. We had 26 participants that took part in it. There were 65% identified as Black, 13 identified as white, and 26% identified as Hispanic. Of those people that participated, 35% were partnered through marriage, 39 reported either being single or never being married. The ages of the children were of their most recent birth that they had here in Guilford County, and the range of those children were from 2 months to 3 years old. Our participants, 39% had either an associate's, bachelor's, or master's degree, and 17% had some college education. For employment during pregnancy, 48% worked full-time, and 13% worked part-time during their pregnancy, while 26% did not work at all. Next slide. So when we think about the participants that were part of the project, We also wanted to know about their healthcare experience prior to, kind of during their pregnancy or prior to. 91.3% had some form of health insurance. All participants that were in this study gave birth at one of the Guilford County hospitals, and 52% reported using either a midwife or a doula as a part of their care team, and 30% used only a OBGYN as a part of their team. So during the phase of really gathering these birth people's experiences and really learning from them, we designed it in a participatory action research process. We wanted to make sure that the people that were doing the interviews were also a part of the community as well. We hired and trained 10 community researchers who had shared lived experience. Community engagement, we use community engagement to recruit our storytellers, who are, of course, our interview participants. And those 16 storytellers shared their stories. And because they shared their stories with us, we did want to provide something to them for sharing those stories. And so we provided them with a $50 gift card. Next. And so after hearing the interviews, learning these stories, we went with our data analysis partner, 6 Dimensions, to really learn about what the themes were that came from this. So I'd like to give a big shout out to 6 Dimensions. Thank you so much for all your hard work on analyzing the data. They are a woman-owned minority public health research, development, and practice company that's focused on supporting better health outcomes for all people and communities by creating strategies that address systemic inequalities. So again, thank you so much, 6 Dimensions. Next slide. So we'll move into some of our key themes with the reproductive cycle, starting at preconception care. One of the things that kind of stuck out was that most participants didn't discuss preconception care at all. Some also lacked primary health care or had no health care prior to their prenatal care. And then some also discussed their family planning processes and needs for fertility treatment. So one of the quotes that was mentioned in the interview was that one person said, "I hadn't seen one," meaning primary care, in over probably 5, 6, 7 years before the baby. So that speaks a lot to what is happening in the preconception period. Next slide. And as we move forward through the pregnancy and go into our prenatal care, some of the things that stuck out in this area was the importance of social support, be it family as well as social services or healthcare services in the community. Also the barriers to care, especially when seeking and reaching care. There were several financial barriers, out-of-pocket costs, as well as challenges with insurance. And then self-advocacy was critical at the start of the maternal health care process, just to ensure that patients received good providers and sought additional resources, such as having a same-race provider, doula, midwife. So when we look at some of the key quotes that people mentioned about the prenatal care period, some mentioned that Healthy Beginnings, they were in the Healthy Beginnings program. So the Healthy Beginnings, I had a doula, and they gave me a lot of great strategies. Also, I asked them, what am I supposed to do? They said, we don't know, either get them to change their Medicaid, or they really didn't have an option for me. So this kind of tells you kind of the different ranges of responses that we got when speaking about the prenatal care period. Next slide. All right, and so when we think about the birth experience, when our storytellers were telling us about their births and what that experience was like, there were several themes that also came up. There were some challenges with unmet needs and expectations for a birth experience not being fulfilled. Also, these challenges coincided with themes of implicit bias, medical racism, which caused some of the storytellers to feel silenced and having their pain dismissed. There are also several interviewees who noted positive experiences. Most of our storytellers that mentioned positive experiences were white and or they had a doula or a midwife as their additional layer of support. Also, since the period in which we were talking to, well, the period in which people were talking about their experiences happened throughout COVID, it also talked about the impact of COVID on these storytellers. So when we look at some of the key quotes that were mentioned from their birth experience, some people mentioned that everything was just rushed. Like, I felt the first cut and, I was like, what I felt that. And he was like, oh, you're just feeling pressure, just keep going. I'm not sure if I want another child at this moment, and maybe in the near future, I'm not sure if I want to have another one, on how painful and traumatizing it was from the hospital. So these are some of the experiences that people talked about when they were giving birth in our Guilford County hospitals. Next slide. And so as we continue through our reproductive cycle and move into our postpartum care, some storytellers mentioned that social support tended to decrease in the postpartum period. There were several unmet mental health needs mentioned due to access as well as the lack of social support. And then again, the impact that COVID had on the postpartum period. So one of the main quotes that was mentioned in the postpartum period was, I probably would have said I was fine even 6 months down the line if someone evaluated me for my mental health checkup or whatever, just because I didn't want no interventions. But I did know I did have some form of postpartum depression. Next slide. And so as we go down the journey of kind of what that reproductive cycle looked like, we also wanted to find out more about our storytellers' experiences with their provider. The three themes that largely stuck out in their experience with their providers or in the patient-provider relationship was in relation to unmet needs, as well as the expectation of care and the impact that race or racism experience. Individual and systemic levels of racism or medical racism were described by a large number of storytellers, as well as racial bias through implicit bias from the provider to the patient was felt. And this was seen through the dismissal of pain, either during birth or in the postpartum period. But then some storytellers also told about the importance of having a same race provider or the option to select a same race provider was mentioned by some of these storytellers. So some of the key quotes that were mentioned by our storytellers is, I don't feel like they did enough. It was just more so like, well, we know more, so we're just going to stick with this plan. And when it comes to us advocating for ourselves just as a minority, I don't feel like we were heard. Certain things are pushed more because, being a minority. Next slide. So when we think about the experience from preconception care all the way through the postpartum period, and looking at the experiences with the providers, The participants felt that race or ethnicity impacted their care. Systemic racism continues to be the driver of maternal health inequities. The current system of care make it challenging to really quantify and measure race, particularly in quantitative research. That's why we believe it's really important to take a qualitative approach, and through storytelling, hearing the stories of the experiences of birthing people to further dismantle systemic racism. Experiencing acts of interpersonal racism coupled with systemic racism make it challenging for Black and Brown birthing people to seek and receive equitable services that allow them to have autonomy over their health-related decisions. Next slide. So with all that in mind, from our project, from this phase of the project, we do have a few recommendations that were provided. Next slide. And they are in 3 levels. So we have our individual level, community level, and a systems level. For individual level, increase community health education about general and perinatal health, especially in the preconception period and prenatal time periods. This could be beneficial to better engaging the birthing people with available resources, to help establish those additional layers of social support, and also to augment individual advocacy strategies so that birthing people can advocate for the things that they need during their preconception period, prenatal, postpartum periods as well. At the community level, we want to assist and communicate with partner agencies to ensure that all available services for birthing people and their families are made known and are easier to access. Also establish postpartum support groups to ensure that mental health and social support circles are created. This can help to lower the levels of fear around seeking treatment for mental health, and also help to eliminate some of the stigma around receiving care for mental health. Connecting birthing people with services like doulas and midwives to assist with advocating throughout pregnancy. For the systems level recommendations, they include increasing opportunities for healthcare provider trainings, partnering with care providers and coaches on the delivery of information during prenatal birthing and postpartum phases, as well as providing diversity and equity training for providers to improve implicit bias and other forms of racism that perpetuate birthing experiences, especially for Black and Brown families. Also improving access and the facilitation of prenatal care utilization, and increasing care coordination throughout pregnancy and postpartum experiences. So these were the recommendations that were made from the analysis of this phase of the project. We're really excited to have this information so that we can move forward with making systems level changes here in Guilford County, and also continuing to work with community members, community partners throughout this process. Thank you. And I will turn it back over to Jean.
Thank you, Monet. We are so grateful to you and the leadership that you had with this project, with Dr. Nikitra Burse with Six Dimensions, who, as Monet stated, served as our data analysis, and Dr. Stephanie Baker and Dr. Kimberly Harper, who worked with us on the research design team for this research project. There will be much more to come from this project, as we hope that it will have legs. We will be implementing phase 2 of this project in this next upcoming fiscal year, where we will interview doulas, midwives, healthcare providers. So for those of you, we've got a lot of doulas on the call or this meeting today, and so you'll be connected and involved in that next iteration. Well, speaking of midwives, we wanted to host a partner spotlight today with Cone Health, and I am so very pleased to have Jamela Walker with us today from Cone Health to share with us all the work that Cone Health has been implementing to ensure system level change in service delivery, especially in maternal health. And she talked about flying by the seat of our pants. We often do that in this work. Today, she was serving in labor and delivery and has been able to hop on to be with us. Jamela is a board certified nurse midwife, certified lactation consultant, and former birth doula. Jamela specializes in reproductive health care of people from menstruation to menopause, including transgender and non-binary patients. She has an innovative and curious compassion where she partners with patients to explore the root cause of illnesses. She comes up with the best individualized plan of care and maximizes wellness from each patient's personal starting point. Her work at the Center for Women's Health Care combines her background as an African-American studies graduate, years of community birth work, and traveling down as many health equity rabbit trails as possible. She is the health equity app team lead and helps spearhead many of the health equity activities at Cone Health. I am pleased to introduce y'all to Jamela Walker, and she will talk to us about some of the things that Cone Health has been implementing for some time.
Good morning, everybody. Can everyone hear me okay?
Yes, we can.
Okay, great. Did you want me to be on camera, Jean?
Jamela, whatever is comfortable.
You can put me on camera. That's fine.
Yeah.
Or not. Good morning, everyone. Thank you so much for inviting Cone Health to be a part of this really important conversation. I am very excited to go after the information presented by Every Baby Guilford so we can show you that we are listening. We know that there is quite a bit of work that needs to be done. We've to borrow the terminology, we've started at the groundwater work, and everything that we're doing is aimed to improve the environment for the people that we serve. So if you guys want to start my slides, that would be great. Hi, everybody. Okay, we go with, our motto is we're with you. And so I'm going to talk a little bit about our health equity efforts. My presentation really centers on what we're doing in the women's service line because that's where all my work has started. And I do have a couple words to say about what the system has been working on. Next slide, please. Okay, so here's what we've been doing. We have I think there were two groups that kind of came together to form the Women's Service Line Health Equity Committee. We meet every month. We get together and we, have long discussions about this work and what we should be doing. One of the things that I'm not sure I put on here is that we did start Center for Women's Healthcare, and then it kind of spread from there. Did complete all of the providers completed the REI's groundwater training. That was one of the ways that we started. And then from that, we have just been getting together, discussing different ways to move the needle. And one thing that we keep centered in our work is that it's one thing to come up with all these policies and procedures that are aimed at bringing down maternal health disparities and infant mortality disparities and things like that. But we really need to work on the environment that our patients are coming into to make it a safe, trusting environment. And I think that the previous presentation really highlighted the importance of that. So one of the things we've done is we formed a group called One Cone, One Book, and it is a book club. About quarterly last year, and then it's a little bit less because that seemed kind of heavy on, we've been operating in a pandemic, and so it's hard to get everybody together. But One Cone, One Book, we get together, we got some funding to provide books and audiobooks, and so people can come to our library and pick up a book. And then we have guided conversations at the end of the period of, it's quarterly, so we give them a quarter to read the book, and then we get together. And so here, this is the list of books that we've been able to work through together. We read Waking Up White, which is very interesting. We've read Just Mercy, How to Be an Anti-Racist, Small Great Things, which was interesting because it really talks about this work that we're doing. We read
Jamila, I think you have frozen. Folks were working to troubleshoot this. There was a power outage blink, so Jamila's computer is completely shut off. Walida, are you on? Can we get, if Walida is still on?
Walida isn't on as a panelist, so it would be harder on the back end to bring her
got
up.
These are moments in the virtual space that I call them the hiccups that you don't like because they continue and they pester. I don't know. Cone Health is doing a lot.
We were able to promote Walida. There we go. We're gonna work
good. We
this
got
out.
Walida.
So Walida, if you can hear us, you could unmute. And
I can hear you.
Awesome.
And it just won't let me show my video. It says the host has stopped it. And
try
Jamila
it again.
said she might be jumping back on because I definitely want her to talk about the doula work that she's leading.
You can try it again, Walida.
Okay.
There you go. We see you.
Is that okay? Great.
And Jamila's back in. So
I'm back. Oh my gosh.
Okay, I'll add one point on the One Cone, One Book. One of the interesting things about this work is that it's not just for the women's service line. This went across the whole health system, and our CEO participated in a lot of our executive leadership team. And this is something that they have been committed to. So I will jump off and let Jamila jump back in on the volunteer doula work.
Thank you, Walida. We've also been able to partner with AuthoriCare. They participate in these conversations as well. And that highlights our community partnerships we've been able to do with One Cone, One Book. We co-sponsored an in-person talk about Raising Lazarus, which talks about substance use disorder and how it has manifested in our country. So we did that with Greensboro Bound. And then we just recently co-hosted the Brian Series talk with Jose Andres and discussed We Fed an Island, and then had additional discussions highlighting food insecurity and what we do about that in Guilford County. So that's been a really fun thing to be part of. And then, yes, we have a volunteer doula programming and credentialing. I am the coordinator director of this program. This one is very dear to me because I've been a doula in the community for, I can't count, since 2010 when we moved here. When this became very important. I come from back in the day when it was very actually hard to get into the hospitals because we didn't have any credentials. And at one point when I ran a collective, I just made myself a badge, and that seemed to really help. So when the COVID-19 crisis began, and the visitor restrictions kicked pretty much everybody out of the hospital, and we knew that doulas needed to get back in for all of the reasons that we have previously highlighted. I had the pleasure, I was already on the health equity team, so I got to help build the process to getting doulas back in the building. At the same time as we were working on it, other hospitals were as well. We were the only hospital to step up and say, we will do this without any cost to the doula. And so we've been able to onboard over 100 doulas, the vast majority of whom are women of color that support our patients of color who are at the highest risk. And then we were able to start a volunteer doula group. So we've been able to train, I think around 30 doulas. And then we have very strict criteria because we really don't want to overwork these unpaid workers that provide this very important work. And we're working on a way to get them paid for this. But they attend births of patients that demonstrate a financial need in some way and also a high risk need. So what we are really targeting are most at-risk patients. We are looking toward the future to expand this program and really get a way to pay the people who are doing this work because we want to support their attendance at births. And having, a coordinator that's in-house, that's a midwife, has really increased the communication between doulas and staff. So when problems do arise, the doulas have someone to come talk to to talk to about it, to report what they saw. And then the staff also have a person, and by person, I mean me, to report what they see. And then I can act as a bridge between the two groups because we are all part of one team. We are all on the side of the patient, and communication is how we work together to make that happen. So I'm really excited about the work that's been done there. And then the other thing that we've been doing as a group is we've started to look at the policies because we know that some of our policies in the past have caused harm from a racial bias point of view. One of the major ones that we've seen is the drug exposed newborn screening policy. Previous to our taking a look at it from an equity lens is, it was very subjective. If someone thought that the mother or patient had been using any kind of substance, or my favorite language was on there was if she appeared anxious or agitated, then you could order a newborn drug screen. The other problem that we were seeing is that not always the people ordering the screen were not always informing the patient that the baby was being screened. And so parents would open the diaper and find cotton balls and not understand why they were there. And so we have changed that it is part of the policy that the parents are informed and it's discussed with them. We've removed the harmful language and the subjective methods of screening. And so they have to meet certain criteria before we can introduce the newborn screen, and then we have to discuss it. So that is wonderful. And we are continuing to look at other policies to see where we can make changes as needed. One of the things that we did once we completed, a lot of people had completed the groundwater training, was looking at other ways to highlight the importance of this work. And the Toxic is a short film. It's like 20 minutes. And it talks about, it really just highlights, it follows a Black woman and her family. And my favorite part of it is that they're an affluent family. I think she's a lawyer and dad is some kind of consultant, but they have, they're very educated. So it highlights the fact that it's not just because people are poor and sick that they are experiencing these disparities. It is because of their experience living as Black Americans in this country. And so you follow their day as she complains to her provider about several issues. She's about in the middle of her pregnancy. The provider dismisses them completely and she goes on to lose the baby that day. It is very striking. It is hard to watch. And we have had several viewings of it. We started with our little group. We had a very difficult, frank discussion about how we wanted to let this fuel our work. And then we've invited several other groups to watch it, starting with leadership and kind of filtering down. That's the way that we have been approaching all of this, is we start with leadership, we have the discussions, and then we move it throughout the system. And it's the whole system. It's not just Women's Service Line. We are the committee, but then we are very good. Our leaders are very good at tapping their other leaders in other parts of the hospital to do the same kind of work. And And then the other thing that we've really started to do is trying to address racial bias using quality metrics. And so working to include quality metrics for the Center for Women's Healthcare providers. So we're starting to see, like, can we look at the percent of primary cesareans that are performed based on race and ethnicity? Is that higher for certain providers than others? And is that something that we need to discuss? Making sure that all of our providers are going through substance use disorder training. That's actually one of the things that we get paid our bonuses on, is if we did this training. And the training is very comprehensive, and it really makes you address your internal bias when it comes to treating patients with substance use disorder. And then how often are we prescribing and talking to our most at-risk patients about aspirin use, because we know that aspirin is a very low risk intervention for patients who are at highest risk for chronic or gestational hypertension and preeclampsia. And those are huge for our most at-risk population. So those are just a few of the things that we are working on for the quality metrics. Next slide, please. Okay, so here's some of the work across the health system that we're working on. We have started collecting real data and focusing our outreach based on what we find. The REAL stands for racial, ethnicity, and language. So an example of something we've done with this that we got to see in real time was when we started to see more of our Dari speaking population pop up in the area once the kind of rescue missions out of Afghanistan, when we pulled out of that country. We suddenly started, it was difficult for about a 2-week period because we could not find interpreters. And often when we could, they were male, and the women would not tell us what was going on, which we found very difficult. But then we've started to get more interpreters that speak Dari and are female, and that has really increased our ability to communicate and provide compassionate care to these patients. We've improved access to care using community care and residency clinics. So we're targeting places that have less access to care and putting them in different places in the Greensboro area codes. We have looked at increased LGBTQ awareness of identities and clinical needs, and we're starting to make changes in our clinical settings accordingly. We are addressing social determinants of health through increasing our transportation programs, again, our language offerings, and food insecurity. My favorite example of addressing food insecurity is the Brito food program that we were able to put in place at the Med Center for Women. And I can, as a provider, it is so wonderful for me to screen that patient or hear from that patient that they are experiencing food insecurity and say, go just across the hall, we can help you with that, right now. And then community outreach, we have mobile medicine, congregational nursing, our COVID-19 testing and vaccination sites were huge. I think another example of community outreach when it comes to mobile medicine is our meds to beds program that we have here. So for instance, I have patients who are discharging today. They have hypertension, they're at risk for preeclampsia, they've had a C-section, so they need a small regimen of oxycodone or something. We're able to send them out the door with the medications that they need, so they're not having to stop at a pharmacy on the way home. And then addressing disparities in pneumonia and schizophrenia. This is something that was just highlighted for us because we have a new committee that just formed. It's the cone-wide, system-wide physician champion health equity. That's what's below. And one of the things that we discussed is that they were looking at the rates of admission for pneumonia and the treatment of schizophrenia in certain places, and we're starting to target those areas, and how well we are aggressively treating pneumonia so people aren't having to be admitted for it. And then this quote that we have from Dr. Martin Luther King Jr. is what fuels the work in the Health Equity Physician Champion Committee, we are really focusing on this quote specifically. Of all forms of inequality, injustice in health is most shocking and the most inhuman because it often results in death. And that's what fuels our work, especially in the women's service line, is the rates of maternal mortality and infant mortality continuing to rise is just inexcusable with all of the technology and all of the knowledge that we have. And so our work is really, really important to prevent this from continuing to rise. It needs to drop. Do I have another slide? Yay. Moving forward, the things I'm working on, I picked this picture because this is the focus of our work, is keeping these happy faces healthy and with us. I think I put all of the same things in the moving forward, but this is what we're doing. We are continuing our One Cone, One Book. We get to do more in-person events now that the COVID and flu rates are dropping. And those tend to go really well because we get to see each other's faces. We have strategically placed them around different areas. For instance, the in-person event that we did for addressing food insecurity was done, I forget the name of the library, but it was right by the Second Harvest Food Bank that is also right by the Renaissance Family Medicine Clinic, and it's in a food desert. We did that on purpose, and we're going to do more things like that. And then we are, like I said, we're planning on expanding the doula program in a way that gets doulas paid for the work that they're doing. Yes, the McGirt Horton. Thank you very much, Shayla. We did at that library. We're looking at additional policies to see how we need to rewrite them or adjust them to get rid of the racial bias that's there. We will be viewing more things like toxic together, and then again with the quality metrics. I think that's it for me.
Thank you so much, Jamila. Cone Health is indeed doing so much in our community to truly, what I say, walk the talk in addressing these health inequities and to making that system level change that needs to happen so that we can have healthy birth outcomes and positive maternal health outcomes for individuals in our community. Next slide. Some key takeaways from today's event. The data captures information from 2 years ago. So this is not data in real time. We will constantly be 2 years behind in the data. It demonstrates that there is still a lot of work to be done. We are looking at the experiences behind the numbers to find groundwater solutions. We're only in year 2 of this collective action strategic plan. Many partnerships and programs have been put into place, but we will continue to co-create and learn from our processes to understand our impact today. Aha moment for me today is meeting Deborah Cates. We're so thankful that you are on and sharing your contact information, because that's how we build these partnerships, by getting to know one another and making invitations for us to have opportunities on campuses such as Bennett. While we may be moving the meter in some areas, there is so much work left to be done. And together, we are Every Baby Guilford. This effort takes collective action towards collaborative, cross-system, or groundwater solutions. Next slide. We hope that you will stay connected with us, join the movement, and here are some ways to get involved. If you will, please subscribe to our newsletter. You can go to everybabyguilford.org to subscribe to the newsletter. You can follow us and share information from social media. We post weekly perinatal health messaging. Each month is a new health topic that we promote. And in our newsletter that goes out typically the first week of each month, we share the calendar, the social media calendar and the social media toolkit. That's the word I want. We share the social media toolkit. You can take that toolkit if you work for an organization, and please adopt, adapt, and make it your own and help us spread the word and share information so we can get to as many folks in our community. Engagement is mutual. Let us know how we can engage with community efforts that you are involved in. We would love to present at gatherings. If you're part of a faith community, please invite us to your faith community. We'd be happy to share this crucial conversation along with any other presentations on perinatal health topics. If you are a part of a neighborhood association or a community, you have a community meeting that gathers, we would love to become part of those networks. We want to network with your networks. You can learn more about programs and engage and share with others by checking us out on our website. Join Community Action for Healthy Babies. We just reignited this month, which is a collective action team of community stakeholders with a desire to make meaningful impact to this work. And you can get connected with Community Action for Healthy Babies by emailing me at jworkman@guilfordcountync.gov. Next slide. We are very pleased to share that a Black Maternal Health Conference is, I should say Black Maternal and Infant Health Conference is going to be taking place April 14th and 15th at the GTCC in Colfax. The Black Pearl Society of Guilford County is hosting this conference along with many sponsors that include North Carolina DHHS, Guilford County, Durham County Health Department, and Every Baby Guilford, along with others. On Friday, April 14th, REI is going to present a groundwater training to participants, which will lead into dinner. And then after dinner, we will view Aftershock documentary. And after the viewing of the documentary, we will have the family of Shamani Gibson with us, along with Bruce McIntyre, who is the partner of Amber Isaac. Both Amber and Shamani Gibson died during labor, and they'll be present with us on Friday night to share the experiences and have a conversation with participants. On Saturday, April 15th, we'll reconvene back at GTCC Colfax. Dr. Karen Scott will serve as a keynote address speaker, and we're going to have a multitude of breakout sessions that folks can attend. This is during Black Mamas Matter Week in April. The registration fee is only $35, so we highly encourage and invite you to participate with us in this inaugural Black Maternal and Infant Health Conference, where we hope to continue doing this annually. Next slide, please. We thank you for your time. We hope that you'll share your reflections and feedback by participating in this survey that you can link to with this QR code. Of course, I get choked up at the very end. We are bringing the community together with collaborative solutions. We hope that you'll join our movement to work to ensure that no rock is unturned to positively impact our bold goal to reduce infant mortality disparities by 50% by 2026. As Consuela mentioned earlier, working together, we will collectively ensure more Black babies are born healthy and live to celebrate their first birthday. Because when we create a healthy Guilford County for Black babies, then we create a healthy Guilford County for all of us. Thank you for joining us today.